Okay, so we have a patient here, came all this way with the expectation, no, he's going to do great and everything, and he had a complication. False advertising, you know, hey, what the heck is this, Dr. Rutledge? Everybody else is running around, going to Boulder Highway and having fun, and here I am having trouble. Well, let's see if we can talk about that. Surgery itself, I think, went pretty well.
Oh, fine. Yeah.
And post-operatively, though, he had some trouble swallowing. Why would that be? Let's think about it common sense-wise. If you think about it, the surgery itself involves a masked man sneaking up on you while you're asleep and defenseless and stabbing you 5 times with a spear. Then grabbing your stomach, stapling it, crushing it, sewing it to your intestine. Is that really the way to talk about this if you want to advertise it on the video? You know? So when you do that, then we say within minutes, within hours after that surgery, we say, hey, why don't you have a drink of Gatorade? If you think about it in that kind of traumatic way that I described it, it's maybe not too surprising that if you drink or eat right after some character has cut and stitched on your stomach, that it could be painful. Okay? What we're blessed by is many of our patients don't have pain. But it's not surprising that in some cases, the stitching and sewing and the trauma, the damage of surgery, can leave some raw edges that when you eat or drink hurt. Or the other thing is placing the breathing tube in the back of your throat can rub it raw. So you want to go to swallow, but it's been beaten up, it's traumatized, it's injured, it's scraped. And just like if you have a cut on your finger and you put salt water on it, it hurts, or you put lemon juice on it, it hurts. When you go to drink after surgery, in some of our cases, a well-known complication that we're not happy about is you have trouble drinking. Now, the only thing you have to do after surgery is drink, but if you can't do that, what do you think could happen? You could get dehydrated. That is, you don't have enough fluid because you can't eat or drink. And that's why all around the world, most surgeons who offer this kind of surgery keep people in the hospital for a week. So it's very radical to send patients home 24 hours after major abdominal surgery. And when I was a little surgeon growing up, they taught us every single patient with this kind of surgery had a catheter in their bladder, a tube in their nose, an IV for a week until their gut started working. And what we found is many, if not all patients, can go home right away, but some people demonstrate that that old approach that the old-timey surgeons used to use is not a bad idea. Now in your case, when you notice the dehydration and the weakness, the tremulousness and things like that, then you noticed that unpleasant feeling and you called me and we sent you to the ER for them to evaluate you for more serious problems. And what they demonstrated was they didn't find anything serious, no leak or infection or bleeding or blood clots or death or anything horrible, but that you were about 2 quarts low on your fluid, which makes sense because you weren't able to drink. So we gave you 2 quarts of fluid, gave you a little bit of pain medicine to numb up the back of your throat, which was raw and painful, and since then you've done okay.
100%.
So that's a complication. It can happen. We're disappointed by it, but on the other hand, in the big scheme of things, there are worse problems.
Oh, yes.
And as we point out, you're not 25, so going through major surgery like this and having to have 2 quarts of extra fluid in the ER on a Sunday, in the big picture, we're kind of okay with that. We're not happy with it. We're disappointed. That is a complication, but not too bad. Now back to your question. You're saying, well, I got in trouble with dehydration. What should I do now? How much do I know? How do I drink? How much do I drink? Okay? And that's your question. And here's another way of saying that same question, which is, how much gasoline does your car need? Every day, when you think about it, how much gas does your car need? Well, it depends. So when you ask me how much to drink, the answer is, it depends. So if you're active in the sun, lifting weights, working outdoors, you'll need a different amount than if you take a bite and You sit all day running a 911 dispatch. Those two are two very different things. And so if you're active, you may need a lot, and if you're not active, you may need less. Now, still though, you want to say, if I had a car, I could look at the gas gauge, and I could determine I need more gas. In the case of dehydration, we can tell if you need more gas by just having you stand up. So if you're sitting down now, we can tell if you're dehydrated by just saying, stand up. And if you stand up and you say, hey, let's go shopping, let's go to a movie, let's go for a walk, you're drinking enough. If you stand up and you say, holy mackerel, and you fall down, not enough. If you're weak and dizzy, like you found, you're dehydrated. So we don't give you a guidance and say drink 2 quarts a day, because everybody's different. But we can tell you an easy way to assess whether you're drinking enough, and that's simply just stand up quickly. Now you can be more scientific. You can stand up quickly and measure your blood pressure and pulse. And if your blood pressure and pulse when you're laying down are good, but when you stand up they go down, then that can be an indication that by more scientific measure, but just stand up. That's all you have to do. Does that answer your question? Okay. That was a good one, so I'll stop there.